Nitroglycerin is a drug used to prevent both acute and chronic episodes of chest pain in individuals. Nitroglycerin dilates the blood vessels in the chest to increase blood flow and oxygen supply to the heart, and can be administered through a spray, tablet, patch, or ointment. Nitroglycerin increases the exercise capacity of an individual with stable angina by increasing their exercise tolerance without experiencing chest pain. The common side effects with nitroglycerin usage includes dizziness or lightheadedness, headache, and flushed skin. These individuals should be cautioned as taking nitroglycerin in conjunction with erectile dysfunction medication is contraindicated as it can cause an unsafe drop in blood pressure. What if one of your clients experiences chest pain during exercise? They should immediately stop exercising and take a seat and have one spray of nitroglycerin. What if their chest pain continues to persist? Wait 5 minutes, and if the chest pain is still present, continue by taking another spray of nitroglycerin. A maximum of 3 sprays can be taken within 5 minutes of each other if necessary. If 3 sprays cannot eliminate their spell of chest pain, immediately call 911 so they can receive appropriate medical attention. The final class of drugs we will familiarize ourselves with are those designed to control cholesterol levels. There are 3 common categories of cholesterol medications: statins, bile acid sequestrants, and cholesterol absorption inhibitors. This chart lists some of the more prevalent drug names you may encounter with your clients. Please take note of the drug Lipitor, which is a statin and is currently the most widely used cholesterol medication. Statins affect both the absorption and production of cholesterol in the liver. It helps to lower LDL cholesterol, while having a smaller effect on increasing HDL and decreasing triglycerides. Statins can also help to stabilize existing atherosclerotic plaques, which can prevent the more serious events such as a stroke or heart attack. Individuals on statins will have no direct effect on their capacity to exercise. However, side effects do come with the drug, including muscle pain and weakness, upset stomach, nausea, and liver dysfunction. An important point to note is that individuals must be aware of the difference between muscle soreness that may be the direct result of exercise versus the side effect of their medication. Bile acid sequestrants are another form of cholesterol medication that affects cholesterol production in the liver and dietary absorption. Bile acid sequestrants disrupt bile acid circulation in the gut so they can bind to compounds in the GI tract, preventing their absorption. Bile acids are made from cholesterol, so increasing the bile acid secretion disrupts their cycle, leading to decreased cholesterol levels, specifically LDL. These have no direct effect on exercise. However, there are side effects that exist with the drug, including diarrhea, malabsorption of fat-soluble vitamins A, D, E, and K, which can lead to deficiencies. These can also bind to other drugs in the GI tract, which can prevent their absorption into the bloodstream. Cholesterol absorption inhibitors are the final class of cholesterol medications we will look at. This drug prevents the dietary absorption of cholesterol in the intestine. This will result in a decrease in the amount of cholesterol circulating in the bloodstream that the liver can use to produce LDL cholesterol. This ultimately results in lower LDL cholesterol levels. Cholesterol absorption inhibitors have no direct effect on exercise, however they do come with some side effects. These include muscle soreness, fatigue, stomach pain, diarrhea, and a headache. With muscle soreness that can present from medication, it is important to differentiate this pain from exercise and medication. You can do this by asking specific questions such as, is the pain constant? Is the pain bilateral? Is the pain a full body ache rather than an isolated to a specific area? If the individual answers yes to any of these questions, this indicates the soreness is a side effect of the medication, and they should speak with their doctor. The information presented in this section on medications may seem overwhelming and complicated. The takeaway message from this material can be simplified to 2 key points. Firstly, it is important to understand how medications interact with the body and how they can impact an individual's capacity for exercise. And lastly, it is crucial to promote active communication between individuals and their physician and pharmacist. If they have any questions or concerns regarding their medications, it is important to address these issues and concerns as soon as possible. Now, let's take a quick look back and test our medication knowledge. What is the purpose of a calcium channel blocker? A. To decrease heart rate. B. Increase exercise capacity. C. Decrease blood pressure. Or D. Prevent blood clotting. The answer is C. Decrease blood pressure. Nitroglycerin's primary function is to A. Prevent blood clotting. B. Decrease heart rate. C. Decrease cholesterol levels. Or D. Prevent chest pain. The answer is D. Prevent chest pain. Nitroglycerin should not be taken with A. Viagra. B. Grapefruit. C. Cholesterol medications. Or D. Water. The answer is A. Viagra. What is the maximum number of sprays of nitroglycerin a patient should take before calling 911? A. 1, B. 2, C. 3, or D. 4? The answer is C. 3. Cholesterol medications have a direct effect on exercise. True or false? The answer is false. Statins should not be taken with A. Viagra, B. Grapefruit, C. Nitroglycerin, or D. Water. The answer is B. Grapefruit. Congratulations! You have finished the medicine module. Please click on the HeartWise symbol at the bottom of your screen to get back on track.